65,000 hospital workers in Ontario will receive a 6% wage increase over the next 2 years. This is after a new deal was reached between the unions and the Ontario Hospital Association. And right now, we're joined live by Michael Hurley, president of CUPE's Ontario Council of Hospital Unions. Michael, first off, what does this mean for these workers?
Well, they'll receive a 3% wage increase as of September 23 and another one September 24. They'll see their evening premiums and their weekend premiums, their night premiums increase. There's significant improvements to their benefits, and there are other features to this agreement. And I think what it'll do is lift the spirits of people who have had a hard time over the last several years, first with the pandemic and then with the significant workload crisis in the hospitals.
Okay, right there, Michael, draw the correlation between morale and the actual level of service that people will receive in hospitals.
Well, there's 30,000 vacancies in Ontario hospitals for staff, and of course we already had the fewest staff and the fewest beds to population of any province in Canada. So, this hospital system has been swamped by an aging and growing population, and the effect of that, is a difficulty the public experiences with access, quality of care problems, of course, and for the workforce, incredibly difficult workloads and particularly challenging during the pandemic. So people have been leaving, and what contract resolutions like this one do is encourage people by saying they're you are valued, and you will see some improvements in your wages and other areas. Hang in there.
And what about the 6.25% retroactive wage increase and also Bill 124?
Well, I mean, Bill 124 was a horrible problem, not just for us, of course, but for all people in the public sector, because it coincided with two significant events. Obviously, one was the pandemic. So you have people really putting themselves out, and in some cases, like 17 healthcare workers in Ontario died during the pandemic on the job. You've got incredible levels of sacrifice and heroism, and then you've also got a government which is limiting wages at a time when inflation is soaring. That wasn't just a problem for us, but when Bill 124 was struck down by the courts, we were able then to achieve some fairly significant compensation, which helped, I think, to restore morale. And this collective agreement will continue that trend.
Michael, what are some of the direct conversations that you've had with members about this wage increase?
Well, I think people are pleased. They were hopeful that what happened in their last collective agreement, which was a positive one for them, wasn't a one-off. They were hoping that a trend would continue that would see, an improvement for them in some of their basic conditions. In our case, we've been trying to catch up to standards set by the Ontario Nurses Association. We've achieved that in these areas of benefits and premiums, and I think people are very pleased about that, and they feel recognized and valued for that. And, I think that's a positive thing.
And Michael, when it comes to the quality of care that patients receive and also the protection for these employees, what's next?
Well, I mean, we will be campaigning over the summer because, we have a significant crisis at the hospitals continuing with respect to the staff shortages and the impact that has in terms of the closure of services, particularly emergency services, and particularly in smaller communities. But you feel the impact in the Greater Toronto Area significantly. And so we'll be continuing to press the government for additional resources, for more beds and more staff, because this hospital system can't cope really with the wave of people it's trying to process. And this is a relatively short-term problem, but it's a problem that needs to be addressed, or the public will suffer, the patients will suffer, and we're going to do everything we can to try to make that not the reality.
Okay. Michael Hurley, president of CUPE's Ontario Council of Hospital Unions. Thank you for your time.
Oh, thank you for having me.